what I find exciting about inflammatory bowel disease is that 20 years ago, there were two therapies essentially for it, well, maybe three. And they had variable success, but in the long run, they ultimately weren't very successful. We've learned over the work of hundreds of researchers and scientists across the world that this is a very complex condition, which involves both the genes that you were born with, the immune system you develop, and also where you live, where you inhabitate, where you grow up. And it's such a complex disease that we're finding new ways to treat it, new ways to understand it, and new ways to predict what's going to happen. So there's genetic facets of this condition, there are immune facets of this condition, and then also what has become very new is the microbiome, or the types of bacteria that live and coexist in our body actually seem to interact with our immune system and genes in a way that may or may not produce this condition. So this is an explosion of knowledge over the past 15 to 20 years' time, and with that has come new ways to diagnose and treat this often very young and otherwise pretty healthy population. People can go from well and functioning very well at school or at their job to being completely debilitated by this condition. Since it involves the intestines and the bowel, there's a lot of stigma associated with that, and people aren't as ready to openly discuss it with people, not like their heart or their joints. So outside of the scientific side, this condition allows you to form a very special relationship with your patients, because the symptoms from this condition are often rather personal. And if you can break through that and let them know that there's people that understand this and people that can help them out through it, it's a really satisfying job to have.